Awesome. So I would like to introduce our speaker for today, Jean LaMancha. So Jean is a registered dietitian. I think it might be, oh, there we go. A registered dietitian, cancer survivor, and co-author of the Complete Lymphedema Management and Nutrition Guide. And she also has a virtual practice where she helps cancer patients and survivors to use food to meet their nutrition and health goals. And you can also read her Cancer Bites blog and learn more about her on her website at jeanlamancha.com. So Jean, I will pass it over to you for the presentation.
Thank you. And as Vinitha said, this is a two-part series, so you're still going to understand what's going on if you weren't here for last week's presentation. But if you missed it, I would recommend that you watch the recording. So that was Anne Mena, who's a physical therapist and certified lymphedema therapist, talking about the physical therapies for lymphedema. And today I'm talking about the nutrition therapies for lymphedema. And specifically, of course, we're going to address, post-cancer. The views expressed today are mine and not the Lymphedema Association of Ontario or Wellspring. The session is not meant to diagnose or treat any condition, and this presentation does not replace a nutrition assessment by a registered dietitian. And we will have a speaker joining us at about quarter to the hour to talk about her experience living with lymphedema post-cancer treatment. So I'll just keep an eye on my clock here. The objectives for today is to be aware of the research related to lymphedema diet, to understand the effects of fluid, sodium, and protein on lymphedema, to be informed about other nutrition strategies that might benefit lymphedema, and to know where to get more information and support. And just to back up a little bit, because you may be feeling a little lost here at the moment, but lymphedema is a swelling condition, and it is, I wouldn't say common exactly, but it is a known side effect of cancer treatment. And depending on the type of cancer and the treatment that you had, the incidence rates can be, I've seen it for certain conditions, 70, 80%. I think it's more commonly the 10 to 30%. And some things that you can pay attention to, I'm not sure what stage you're at with your treatment. If you are pre-surgery, you definitely want to have a conversation with your surgeon about lymph nodes and what is the plan for lymph nodes. Will they be removing lymph nodes? How many will they be removing? And what I want to say, what technique will they use? So for example, for breast cancer, they can do what's called an axillary lymph node dissection, which the axilla is the armpit. And with that, the surgeon is just using their judgment at the time in the surgery to decide which nodes come out. Then there's a technique called a sentinel lymph node biopsy, in which dye is injected into the cancer, and then that dye is given some time, and then they can follow it and see which lymph nodes take up that dye and then remove only those lymph nodes. So in general, that sentinel node, and I always think of a sentinel, I always think of a soldier who's on duty or like standing at a watchtower. That sentinel node biopsy generally results in fewer lymph nodes being removed, which translates as lower risk of developing lymphedema. All right. And so I'm sure Anne talked last week about some risk factors and how to reduce your risk factors. And so my talk is more about, if you have lymphedema, how to help manage it. But certainly, like any condition you might be at risk for, let's think about diabetes. Maybe you inherit a family history of diabetes. The way to reduce your risk of a developing diabetes from a nutrition standpoint is to eat as if you already have diabetes. So to follow a diabetic diet, to, spread out your carbohydrates throughout the day so there's not too much at one time, and maybe make vegetables and protein the main part of the plate and less carbs, reducing your simple sugar intake, et cetera, et cetera. Same thing I would say for lymphedema. If you know you've had lymph nodes removed or the area has been radiated, and I keep motioning here to this armpit area, but this is only because you can, from the camera up, you can see me here, but certainly you can develop lymph nodes after gynecological cancer or colorectal cancer. Anytime lymph nodes are removed or radiated, there's a risk. And in that case, the lymphedema would develop in the lower body, would develop in the legs, not the arms. If you've had head and neck cancer, so there are a lot of lymph nodes in this area. If any of these are affected, you can get lymphedema in the head, in the neck, even internally, you can get lymphedema. So anytime the nodes are removed and or radiated, there's a risk. So I'm going to teach you how to eat. So this is applicable if you already have lymphedema or if you're at risk for it. All right. And so where is this information coming from? It's coming from the research. It's coming from just a current standard of care. And it's coming from me thinking about, well, how does the lymphatic system work and lymphedema? So let's start with body weight. And this chart, okay, so I just wanted to make sure I had two charts in here, which I do. So what I did here, and I did this as part of the research for my book, and I incorporated to the presentation. I went as far back as the research would let me, which in this case was 1957. And what they were doing in this research is looking at how can we predict who's going to get lymphedema and who's not going to get lymphedema. And basically, for example, in this study, it was 1,000 men and women who'd had cancer surgery and who developed arm lymphedema. So they wanted to look at what were the factors between those people and the people who had surgery but didn't get lymphedema. And now, so you can see this second line here is detailing who was included in the group. A lot of breast cancer research, but not all. And then this is just the nutrition related risk factors. So I'm sure Anne probably shared with you last week some of the other risk factors like getting an infection or getting an injury to the arm, things like that. So if I just look at things that are related to nutrition, what I see is body weight or weight gain or blood pressure. And these can all be impacted by nutrition. Now, the thing about body weight is it's generally not recommended to lose weight during treatment, especially during radiation, because if you've been through that process, you know, the radiation oncologist is going to get you lined up perfectly under that beam, right? And align, like probably tattooing you. I have tattoos myself here and here. They don't want you losing weight, and then the field that they lined up so carefully is now off a little bit, right? It's precision medicine. However, if there is time before your treatment begins, then let's just put it this way. We wouldn't be too upset if there's healthy weight loss, but that's the trick, right? You don't want to lose weight in an unhealthy way and lose muscle. You want to keep as much muscle as possible and lose only fat. And that really comes down to the sensible weight loss regimens, not any kind of a fad diet or a lose weight fast type of program. And if there's no time before your cancer treatment, then that's fine. You're a cancer survivor for the rest of your life, and you can take measures to eat a healthy diet. And even if you don't lose weight from your nutrition changes, even if you start eating a very healthy diet and your weight doesn't budge, I would argue that you're still helping to reduce your risk of developing lymphedema and reducing your risk of a cancer recurrence. Absolutely. So don't get focused on the scale and the body weight and get frustrated with it if it's not moving. Because even changing your diet, getting more vegetables and fruit in there, more whole grains, less refined grains, there's a benefit in that, okay? And some of the other things that you'll see here, you know, high blood pressure, I just tried to highlight things. And then the yellow ones are the outliers. These are the ones that didn't add up, but I really think that they are just that. They're just outliers because the majority of the research shows that either being overweight or gaining weight through your treatment became a risk factor. Now, of course, these are not the only risk factors, right? We'll talk about that. But this kind of research kind of begs the question, well, if I have lymphedema, if I lose weight, will that help reduce my lymphedema? Could weight loss actually be a therapy for lymphedema, not just reducing risk? So there are 5 studies, and I'll, you know, give you the brief outline. But if you like detail and you like to read the research, then on my blog, I describe the research and I give you the links to the study. If you really like to learn all about that stuff, this information is available. So in this particular study, it was 21 women who'd had breast cancer related lymphedema, and they were all put, half were put on a weight loss diet and half were told not to lose weight. We're just going to follow you for 12 weeks and see what happens. And when they lost weight, they did lose lymphedema fluid. And so I measured out here what they lost in terms of arm volume was 228 milliliters. Okay. Versus if they didn't lose weight, they only lost 11 milliliters of arm volume. Okay. And the way they measured that is the women who were in the study had lymphedema only in one arm. So then when they lost weight, they could measure their healthy arm and say, well, of course you lost weight, your arm went down in size. Well, let's measure how much your healthy arm went down. Now let's measure how much your lymphedema arm went down. Let's subtract the amount of weight that your healthy arm lost, because that's just weight being lost from the arm. The difference is going to be the lymphedema volume that you managed to reduce. Okay. So that's what these numbers represent. The total amount lost was 350 mLs, but they also lost 121 mLs from the healthy arm. So they know the difference is 228. Actually, the math doesn't seem quite right there. I guess just 229. All right. In this study, 51 women. So they were either in a weight loss group, a low fat group, or a weight maintenance group for 6 months. But this time, some people in the weight loss group didn't lose weight. Some people in the low fat group and the control group who were not supposed to lose weight, lost weight. So then when these researchers said, well, let's see what happens to the lymphedema compared on which group we originally put them in, there was no sort of pattern. So then they said, well, let's just decide who lost weight, who didn't lose weight. Doesn't matter what group they originally were assigned to in this research. And when they did that, they found that if they lost weight by whatever technique they ended up using, there was a significant reduction in their lymphedema volume, okay, compared to those who did not lose weight. Number 3, this was an interesting one. It was, again, women with breast cancer, and they were either told to come back to the facility where they had their treatment and do an exercise program and a weight loss program, or to do a home-based exercise program or a home-based nutrition program, which was Nutrisystem for 20 weeks. And then the follow-up was weekly or biweekly calls with the dietitian, or home-based exercise and nutrition. They were very successful in losing weight in this protocol. They lost 8% of their body weight, but no improvement in the lymphedema. So this really surprised these researchers, and they thought, well, maybe because they were exercising, if we measure their arm with the tape measure at the beginning, and then, you know, throughout the study at the end, but at the same time they're gaining muscle, maybe that gain in muscle made it hard for us to accurately measure their lymphedema. So that was their theory as to why they didn't see the results they expected. I kind of wonder if maybe they lost weight too quickly out of the gate here with this Nutrisystem program. Because one thing which I'll share with you is that the lymphatic system doesn't have its own pump. You know, the heart, the vascular system, That's the pump for pumping out the blood and moving the blood through the body. The lymphatic system is supposed to bring the lymph fluid from the fingertips in, from the head down. Well, that one's easy because of gravity, but from the toes all the way up without a pump. It has these little lymphangions which squeeze together when you use your muscles. So if you lose your muscle, you're losing some of that pumping power, okay? And so it could just be they were maybe a victim of their own success here. They lost weight too fast and maybe lost some muscle. That's my theory. So if weight loss is something that you're doing, if it is a goal that you have, listen, it's like the tortoise and the hare, right? Slow and steady wins the race. That's what you're after here. This particular study was a ketogenic diet study. So it was 12 people who met every week with an occupational therapist, and they were invited to choose if they wanted to do a ketogenic diet or not. And some of them decided to do the ketogenic diet. And then they measured their lymphedema. So 9 people lost weight. And the weight loss in that case did correspond to a loss of lymphedema volume. Now, the 6 people in the ketogenic diet lost more weight. That doesn't really surprise me. Low carb diet folks lose more weight out of the gate, but generally by 6 months or a year, it kind of evens out. Also, if you just look at the scale, someone who does ketogenic diet, and I have nothing against ketogenic diet, I think it's a good therapy, but you just have to be reasonable when you interpret the results. But when you do keto, you lose glycogen from your muscle, and glycogen is a stored form of carbohydrate. And you also lose water when you lose that. So if you jump on the scale, you think, oh my gosh, I'm doing this ketogenic diet. Look at all this weight I've lost. Well, when you say weight, what you're thinking is I've lost body fat, right? Well, no, you haven't. You've lost fluid and glycogen stores. So the fact that they lost more weight because they did keto, to me, doesn't necessarily mean, that the keto is better, okay? I think if it's healthy weight loss, and some people choose, low carb or keto methods for that, if it's a healthy version, then I'm okay with that. But again, the rate of weight loss is important. And in this particular study, this was 88 women who, again, they did a low calorie diet. But what's interesting in this one is half of them got a symbiotic supplement. A symbiotic is a combination of a prebiotic and a probiotic. So probiotic is live bacteria, right? Because we have live bacteria that live in our intestines. They help to keep us healthy. They're part of our immune system. They help with food digestion, etc. And so we consume them, for example, if we eat a probiotic yogurt or drink probiotic kefir, okay? We introduce new healthy bacteria into our system. And you can also take it as a supplement in a capsule. Prebiotics are the fiber that those healthy bacteria that live in our intestines ferment and use as fuel. And so certain fibers are excellent fuels for our microbiota, okay? The microbiota is that collection of healthy bacteria. So when you put them together, you put a probiotic, the live bacteria, and a prebiotic, the fiber that they like to ferment, you put it together in one supplement, then this is called a symbiotic. And you think of the term symbiosis, right? And symbiosis meaning that, the effect of the two things combined together is better than the individual effects added up, okay? And what they measured here, they did a variety of studies, but they looked at tumor necrosis factor alpha, which is a measure of inflammation, and leptin is like what's called the hunger hormone. So lymphedema was significantly reduced compared to baseline in the weight loss group that got the symbiotic supplement only. Everybody lost weight because they were all put on the same diet, but there was some additional benefits from that group that took the supplement. Low-fat diet is another therapy that's been tried for lymphedema. Now, why would this be? So you need to understand digestion. So if you chew up your food and you swallow it, it goes down the esophagus, goes into the stomach. The stomach starts some digestion, but it also holds onto your food. It's a holding chamber, and it drips a little bit of food at a time into the intestine. And once it gets into the intestine, then it really gets broken down into its component parts. And so, for example, carbohydrate will get broken down into its smallest component, which is a single sugar, usually glucose. Proteins get broken down into their building blocks or small components, which are amino acids. And fats get broken down into their single components, which are fatty acids. Okay. Now, fatty acids are chains of carbons with hydrogens attached to them and different chemical endings. So each fatty acid is a little bit different. They have different properties. But one simple way of classifying them is to say, is this a short carbon chain, a medium length carbon chain, or a long carbon chain? If it's short or medium, so if it's up to 12 carbons in the chain, they get absorbed right here. So once it leaves the stomach and goes into the small intestine, into the section called the duodenum, those short and medium chain fatty acids get absorbed through the lining of the small intestine into the bloodstream. So they are absorbed by the body, right? You hear of digestion and absorption. That's what absorption is. Long chain fatty acids cannot be absorbed there. They're not soluble enough. So they get put into a fat transporter sphere and they go through the lining of the small intestine. And this is what this larger image is showing. So these long chain fats go through the lining of the intestine and they enter into a lacteal. Now, to me, the word lacteal makes me think of the words lactose, lactase, lactate, and if you speak French, the word lait, right? L-A-I-T, the French word for milk. Now, why would this lymphatic capillary be called a lacteal? It's because what gets absorbed there has a milky white appearance. Why does it have a milky white appearance? Because it contains these long chain fatty acids, okay? So it's a very milky looking lymphatic fluid that gets absorbed here, okay? And into this structure called the lacteal. This liquid itself is called chyle, okay? And then gets absorbed into the lacteal, and then there's a bunch of collecting lacteals. It all collects there. And then it goes up to this central little, let's call it union station here. It's called the cisterna chyli, which is a main lymph, again, let's just call it union station. And then up the central lymphatic trunks. And then it enters up here in the subclavian veins, enters the bloodstream. So that means that if you have long chain fatty acids in your diet, they require the lymphatic system for absorption up here. They don't get absorbed into the blood until they travel through the lymphatic system. So what are the long chain fatty acids? So if you think of all different kinds of oils, we've got MCT oil, coconut, palm kernel butter, canola oil, corn, flaxseed, olive, etc. We can draw a line here. All of the vegetable oils are 100% long chain fatty acid. Now, this does not mean that they're not healthy. In fact, if I were just talking to you about nutrition after cancer treatment and how to reduce your risk of cancer recurrence, etc., I wouldn't even mention the chain length of the fatty acid because it's not relevant. And it's not, it's not a sign of the health qualities of the oil. The only reason I'm introducing this topic is because if you have lymphedema, this adds more work for your lymphatic system because it has to transport and absorb these long chain fatty acids. So you might look at this list and say, oh, I thought olive oil was healthy. It is. It's very healthy. It's very high in omega-9 fatty acid. It's anti-inflammatory, but it still requires the lymphatic system for absorption. Okay. So you want to be careful with the amount. Now, some of these oils are not so healthy, like soybean oil is very high in omega-6 fatty acid. Again, the length of the carbon chain does not determine if it's good for cancer or not. Okay. It's just showing you that all of these are going to require the lymphatic system. Now, up here, we've got butter, which has got a bit of short chain and some medium chain, palm kernel oil, coconut oil, and then something called MCT oil, which is 100% medium chain. Okay. Now, just to clarify something for you, if anybody got away this winter, you might have seen one of these palm trees. So palm kernel oil comes from the nut that's on the inside, and palm oil comes from the fleshy part on the outside. So if we go back here, you see palm oil is down here and palm kernel oil is up here. So there's two different types of oil, right? Now, MCT oil, there's no MCT tree that I can show you or MCT nut. What they do in that case is they take the coconut oil and the palm kernel oil and they separate the different fatty acids. And then they put just the medium chain into a bottle and they put on the label MCT oil. And triglyceride means 3 fatty acids with a glycerol backbone. Okay. So that's what a triglyceride means. Okay. So you might have seen products like this, MCT oil, 100% pure MCT oil. It's big in the bodybuilding community. It's big in the keto community. So people who do ketogenic diet like to use MCT oil. But as I'll show you, there's been 2 very small studies on people with lymphedema. So let me just do this here. This particular study was on 2 women who have primary lymphedema. This just means they were born with a lymphatic system that just wasn't great. And they each had lymphedema in one of their legs. Now, one of these ladies was overweight and the other was within a healthy weight routine. And so what the researchers asked them to do was go on a low-fat diet. So really cut out the fatty meats and cheeses and butter and all of that. And they could use MCT oil if they wanted, okay? So patient A lost 22 pounds. Patient A was the one who was overweight. She reduced the perimeter of both of her thighs. She had a 7-centimeter reduction in her lymphedema thigh. She had a 5-centimeter reduction in her healthy thigh. So for a net reduction in lymphedema of 2 centimeters. Patient B did not lose weight, didn't have to, but still lost 3 centimeters around her lymphedema thigh. So they really think that by reducing the amount of fat, reducing the amount of work that the lymphatic system has to do, that it helped reduce the lymphedema. The second study was 10 women who'd had breast cancer-related lymphedema because they had surgery, they had lymph nodes removed, they had radiation, they had chemo. And they were both just given, 5 of them got a bottle of corn oil, 5 of them got a bottle of MCT oil. They didn't know what they were getting though. They took the label off. They said, this is the main oil that we want you to use for everything at home. And they all did the same. This study just says physiotherapy, but I'm assuming complete decongestive therapy. But whatever it was, all 10 women got the same treatment. So the ladies that went home with the corn oil, they gained 75 milliliters of volume, and the ones who went down, used the MCT oil, lost 200 mLs. And they reported they had a significant decrease in the feeling of arm heaviness. So just before everyone goes out and starts pouring on the MCT oil, there's a couple things you need to know about it. 1, it's not going to help you if you still have a high-fat diet. It's not like taking a fish oil, which is anti-inflammatory, but keeping your diet the same. The only reason it works is if it takes the place of other oil, okay? Because if you just add this and now your body processes the MCT oil, okay, fine. But what you really want to do is reduce the work that the lymphatic system has to do. And you do that by reducing the other fats in your diet, okay? The second thing to know is because it's absorbed differently and we don't typically have a lot of it in our diet, it can cause GI upset, can cause cramping or diarrhea, things like that. So you start with a small amount and you let your body get used to it. And the maximum amount you would use is 7 tablespoons a day. The other thing you have to know about it is it can't tolerate a high heat. So you may not be able to use it with every single recipe. You can't, like certainly salad dressings, that's easy, or a drizzle, that's fine. Although for a drizzle, I'm not sure that it would add much because it's doesn't have a lot of flavor. It's not like drizzling olive oil on your food. You get that nice olive flavor. It's like a clear white oil. It doesn't have a lot of taste. Some of them can have maybe a little hint of sort of coconut to them. Anyway, just so you know, in case you're thinking, oh, I'm going to go out and start using this, you do have to be careful. And just go slow with all of these things I'm recommending. You know, I have a program where we work through it one at a time, because the other thing that I want for you, like, first of all, like, yes, I want you to understand your lymphatic system and how it works. I want you to be able to improve your lymphedema if you have it already. But also I want you to understand your own lymphedema and what your triggers are and what maybe individual foods have an impact. Okay, because that's important for, if you have lymphedema, this is a chronic condition. And I think the sooner you understand your own lymphedema and how to work with it, I think the better. Let's look at, what's basically, a good standard of care. We do not restrict fluid. So sometimes for example, if you have cardiac edema or liver edema, and edema just means a swelling or fluid retention, the nutrition protocol would say, oh, you need to restrict your fluid. And in some ways you would think we should do the same for lymphedema, because I got all this fluid built up in my arm or my chest or my pelvis or my legs. I need to cut back on what I'm drinking. And no, that's not the standard. The standard of care is to drink a lot of water. Now, why is that? It's because the lymphatic fluid is very high in protein. And what you're trying to do as a lymphedema therapist like Anne, trying to move that lymph fluid, move that stagnant fluid out of the area. And if you reduce the amount of water that you're consuming, that protein-rich fluid just becomes more concentrated and harder to move. Okay, so you don't want to restrict your fluid. In fact, you want to drink almost in anticipation of your thirst. If you're going to err on one side, I would say err on the side of drinking more water than what you think you need. Again, sometimes people think, oh, it's protein-rich fluid, I should restrict my protein. No. As I mentioned earlier, we need the muscles to activate the lymphangions. And if you restrict protein and become protein deficient, your body's going to break down your muscle, especially if you're in the middle of your cancer treatment. That cancer treatment itself, or even some cancers themselves, like the GI cancers, they can actually use up a lot more protein, and your protein needs can be even higher sometimes during treatment. So we don't restrict protein for lymphedema, but salt and sodium, yes, you do restrict that. So I would even argue that that should be step number one. If you have getting inspired by lots of changes that you can make, then I think reducing the amount of salt and salty foods, you'll notice a big impact with that. So this is just a little comparison of different types of edema. And lymphedema is a standout because we don't restrict fluid. They all do restrict salt. You don't restrict protein. This is the other unique thing, is you don't use diuretics. And this is why it's important to get a proper diagnosis. If the doctor's looking at your ankles and think, oh, maybe it has something to do with your kidneys or your heart, and you get a diuretic, that's not going to help your lymphedema. It only is going to concentrate the protein in your lymph fluid more. So if you're wondering, why can't I just take a water pill? It doesn't work for lymphedema. And let's just look at the last area here, which is inflammation. Well, the last area is sort of, I call it, just using my deductive reasoning here to think, what else can nutrition offer? So I talked about early on when I showed you all those, the weight loss research. And what those researchers were looking to do was to figure out what are the risk factors. Why do some people who go through cancer treatment get lymphedema, and why do some not get lymphedema? Well, they figured these are some of the risk factors. If you got radiation or not, if you got an infection, either a post-surgical infection or later on after your surgery, if you had more lymph nodes removed, if you were overweight or gained weight through your treatment, if you had some kind of injury to your lymphatic system. But it still didn't predict all the cases of either getting lymphedema or not getting lymphedema. So I thought there's got to be something else, another risk factor that we're missing. And what they decided that other risk factor is inflammation. And that's basically what is going on under the skin. And inflammation means, I mean, in your mind, you think, oh, it's inflamed, it's red, it's swollen. Yes, that's true. But what's going on underneath the skin is that there are macrophages present. So macrophages are immune cells. And where they're in the neighborhood, they create this inflammatory environment. And this quote is from this paper. It says, both experimental and clinical studies spanning several decades have implicated inflammation as a critical component in the pathophysiology of lymphedema. Well, one thing I know about inflammation is that, okay, in this particular study, they say also it's evident in clinical and animal models of lymphedema that inflammation, adipose tissue remodeling, and fibrosis in skin and lymphatic vessels occur as lymphedema progresses. So initially, when you have lymphedema, there's a lot of fluid there, and you push your finger into it, you'll see pitting, okay, that little indentation. But unfortunately, over time, the lymphedema progresses. And what happens is that fluid-filled limb gets replaced with a hard fibrotic limb. And what's triggering that buildup of fibrosis is inflammation. Here you see inflammation leading to fibrosis, leading to what they call adipose tissue deposition and remodeling. What that means is in the limb where you have the lymphedema, then you've got these macrophages, and the macrophages are in this area. They're like inflammatory cells, and they say, okay, I know what I need to do. I need to respond to this buildup of lymphatic fluid. I need to start building a structure. And I've got some fat here. I'm going to bring in some fat, and I'm going to start building this scaffold, okay? And I'm going to start thickening the skin. And this is what's going on below the surface. And this is your body's response to the inflammation, is to turn that fluid-filled lymph into a fibrotic fatty tissue and to thicken the skin out, okay? Now, one thing we know is that diet can reduce inflammation. So there's been multiple studies that show if you measure your blood levels of inflammation, and a very common test for that is called a CRP, a C-reactive protein, that we can change those inflammatory values with diet. And so if we have a low sugar, not very many processed foods, foods that are high fiber, low glycemic, rich in vitamins, low in saturated fats, high in omega-3 fats. It's got things like turmeric and tea and ginger and garlic and saffron. And it looks like a whole food plant-based diet or traditional Mediterranean diet. That's an anti-inflammatory diet. And the opposite is a pro-inflammatory diet. So implementing the anti-inflammatory diet has been a game changer for this particular person. So takeaways: diet and nutrition can make a difference for your lymphedema, no matter how long you've had it. So I've had people who've had lymphedema for 30 years and have been able to see improvements. And of course, lots of people who newly diagnosed. So track your diet and your lymphedema. Here's some health approaches: weight loss if overweight, or if your trend is that you've been gaining weight, even if you maintain your weight, that's a win, okay? You don't have to get down to your high school weight or anything like that. Low-fat diet, possibly with some MCT, lots of fluid, lots of protein, salt restriction, anti-inflammatory. And if you need help with that, dietitians can help with that. There is more information and support. If you like to read and you want to read general information or read the research, hop on over to my blog. I've got lots of topics related to lymphedema. And then I also have this book, Complete Lymphedema Management and Nutrition Guide. I also have my cancer book, my cancer risk reduction guide. So there's lots of resources. Today's talk is not meant to give you all the answers. It's just to introduce the idea and let you know that what you eat can matter. And I'd like to pause here, and I hope that June has joined us. Is she on the line, Vanitha?
Join us.
So I'd like to introduce a special guest. Her name is June, and she's a professional woman who is now retired. She was diagnosed with breast cancer in January of 2016, and her lymphedema showed up late in 2020. So look at that, 4 years later. So, and that's an important message, and I don't want to scare anyone, but if you've had lymph nodes removed, it is a lifelong risk that you have, okay? And in June's case, the lymphedema showed up after a partial knee replacement in October. So she's going to share some of her personal experience. And thank you, June, for being willing to do that for this group of Wellspring participants.
Thanks, Jean, and welcome everybody. I won't take too much time. I just wanted to let you know a little bit about my cancer journey. I just went for a routine mammogram, was called back the next week to repeat it on the right breast and to have a biopsy. So I knew something was up, and sure enough, I got diagnosed with breast cancer. I live in Lindsay, so I'm about an hour and a half northwest of Toronto. Saw a surgeon right away. A cancellation happened within 2 weeks of seeing him. Had 1 week to prepare for surgery with the pre-op, seeing my own doctor and whatnot. Had the surgery, had an infection after the surgery in my breast. I had it deep in my right breast toward the bones and right in my armpit. Because of the infection, it delayed radiation. I didn't have to have chemo, but I went through radiation. So that was back in 2016. So I was very surprised had both knee partials done. I was very surprised for any bit of years to get some swelling in my armpit. I had some friends who have had breast cancer and was talking to them, and they thought, oh, sounds like lymphedema. No one had talked to me when I had cancer, anything about lymphedema. I went back to the cancer handbook, that you can order the books in, and there was like a very short paragraph on lymphedema, but no one had prepared me for that. Shortly after that, I had a blood clot develop when I got off my blood thinners due to the knee surgery, and no discussion happened about lymphedema with my family doctor. And then he was more concerned about the infection in the knee. So I really felt I knew nothing about lymphedema. And then my family doctor retired, like a lot of doctors are retiring. So I just happened to stumble upon Jean's nutrition course. I said to myself, I've got to do something. Because I'm a list maker, I like to have a sense that I'm in control of something that I'm really not in control of. So I did sign up for the nutrition course, and that was a godsend. In the course, I was the only newbie, recently diagnosed. I didn't know much, but the group made me feel so welcome. All my questions, no matter how stupid they might have appealed to me, it was just wonderful learning situation. I found that the tracker that Jean had us do about when we ate, what foods we ate, when we slept, certainly pointed out my routines and what could be improved. I really liked the idea of the food tracker, and I used it for maybe about 6 months. Now it's ingrained in my head. I really like the intermittent fasting. I'm about 13 to 14 hours. Occasionally I go off, or if you have company, you know, you can't stop eating at a certain time, but that's something I am still working on. I'm right now, I'm still at stage 1. It's a chronic disease. It will never go away the rest of my life. So it's something that I have to own, that I have lymphedema. I was nicely recommended to see a certified therapist. So I ended up driving, I drive down once a month for an hour and a half down to Markham to have my massage on my arm to try and keep it moving. I have had some thickness in my breast tissue that she moves around. So the whole idea of that is, between me doing my self-manage exercises every day, is to go down and have Anne work on my breast, my shoulder, and my back. I do have taping done regularly. I live alone, so I've had to find someone in my neighborhood that is willing to put it on my back because I can't reach it. So it is something that has worked for me. Again, Jean mentioned about the inflammatory diet, or anti-inflammatory diet. So I try and eat healthier, more herbs and spices, cut down on the sugar and the salt. So my story is going to be different than your story, but I know what is working for me. And I have seen Anne now for a couple of years, and it's still in stage 1. I have ups and downs when she measures me, but it's something that I wasn't expecting, but I have it. The other thing I did was I joined the Dragonfly Association, which is a breast cancer survivor group. They're full of making sure you do exercise, because exercise keeps everything moving. Just completed a 3-month chair yoga session with them for lymphedema and everything. The lady's coming back to do another session with us and to do some strengthening training, because she said that's good for that as well. So continue to keep active as much as you can. Go and get someone looking at your limbs so that they can help you manage that, whether it's making a recommendation that you need a pump, or the sleeve for the arm, or wherever it is. So for me also, it meant switching my sexy bras to, it was first a sports bra, and now it's a compression bra. So that has helped me to do that. So you need to take control of the disease. I have also joined a couple of things. I have joined the Lymphedema Association of Ontario. I go into the US one, the LEARN. I don't know if Jean's mentioned that, as well as the Canadian Lymphedema Framework. They all have wonderful articles on there. One thing I did hand in to my own doctor once I got a new doctor was approaching your doctor, because Jean has mentioned how little time they've been taught about lymphedema. So again, I'm trying to make anyone that comes into contact with me aware of lymphedema. So that's it for me. If you have any questions, I don't mind answering. But again, I really feel that manual lymphatic draining is essential for me. Compression therapy, garments, which is my compression bra, keep me movement and exercise, looking after my skin. And again, even though it's not recognized, I think nutrition is ultimate in my game plan. So thank you very much, Jean, for allowing me to speak today.
You're welcome, June. I know people really appreciate hearing from someone who's dealing with it and living the experience. And so there was one question I answered in the chat about the anti-inflammatory. Do people have questions for myself, or June, I assume you're open to answering questions?
Yes, for a couple of minutes, and then I have another Zoom call to go to, so. I like to keep busy, so.
Yeah.
All right, well, I'll keep an eye out for questions. And so I think, June, I have a question. There's a question for you. Do you find the breast massage painful?
Oh, listen, when I go down and Anne's working on me, it's very relaxing. However, though, because there is a buildup of the fluid in my armpit, I do feel it the next day, some soreness, but I just take a couple of Tylenol and move through it. So it's a low pain. It's, yeah.
Okay, thank you for that. And do you mind, either Jane or June, the question is, can you explain what a compression bra is?
Okay, a compression bra is one that is done up in the front. It's of heavier material. It pushes everything in. I don't know, Jean, you might have to help me out here.
Yeah.
But it's been a real game changer. I do wear something underneath to facilitate the flow of the lymphatic fluid. But it's compression. And so whether you wear a compression sleeve or something on your leg, it's to keep the swelling down so it doesn't pool.
Thank you for that.
And if you can't afford a proper compression bra, start with the sports bra. One thing I was warned not to have one that crosses on the back. They don't recommend that interferes with the lymphatic fluid movement. But yeah, no, it's been a game changer. And I think, Jean, if I'm correct, doesn't some of the companies have compassion thing?
Well, the Lymphedema Association of Ontario has a compassion fund. So because it's medical grade compression, right? It's can be much more expensive than just buying a sports bra. So if you need financial help, then you can talk to the LAO. But it's similar to, as June mentioned, like people wear compression sleeves on their arm or compression stockings, because some people can get compression in the breast or in the chest. And not everyone has reconstruction after their breast cancer surgery too. So some people are without the breast. In that case, they would wear like a compression vest or compression. It's like a camisole. And basically it holds in the swelling, because without that compression, what happens at the end of the day, the swelling is more, the pain is more, the discomfort is more. And Anne probably talked about this last week, but when it comes to compression, there's sort of two phases. The initial phase, the reduction phase, is the multi-layer compression bandaging, where you get wrapped up. It looks like you've got a broken arm or a broken leg, but that reduces the swelling. And once the swelling is stable, then you would move to a compression garment. So if you do not have a compression garment, your first step would be to find a certified lymphedema therapist. And if you're a member of the Lymphedema Association of Ontario, they have this booklet where you look up who's in your area and you find out the therapist, or you go online to their website. But I think it's only $30 to join the Lymphedema Association of Ontario. And as June mentioned, they do lots of great continuing education. So step number one, even if you're not sure you have lymphedema, you think it might just be post-surgical swelling that hasn't come down yet, I think it's worth it to find a certified lymphedema therapist and go and see one. Don't just go to any massage therapist. They don't have the training. Okay, it's not a cosmetic thing, right? You absolutely have to see a certified lymphedema therapist.
Okay.
All right, and now we're at the top of the hour. So
Yeah,
Vineet, I'll let you.
About just one last question for you, June, that you might be aware of. So for someone who just started radiation, they've been measured for a sleeve but haven't started to wear it yet. is there a time that you recommend for the sleeve to start being worn?
That's more of a lymphedema therapist question.
It definitely is. You might want to ask your radiation oncologist, but I, again, would have just wanted to let you know, I had a blood clot come out of nowhere last November. And I phoned Anne to say, I think I have to cancel my appointment. I'm just coming home from the hospital. So it's that you go to them. They're the experts dealing with lymphedema. So she said, let's wait a week or two before you come down to see me. They just want, so I would go there to your massage therapist. So, yeah.
Mm-hmm. All right. Well, thank you so much for that. Thank you both, Jean and June, for your time and sharing everything that you did today.